Insomnia in middle-aged people usually occurs at least 3 nights a week and lasts for at least a month. This condition greatly affects your quality of life. Therefore, recognizing the symptoms and treating them early will help improve your health in middle age. While the rest of the world is sleeping, some people are awake due to insomnia. It is the most common sleep-related problem, with about a third of adults experiencing symptoms. Insomnia at any given time. Up to 10% of people have insomnia severe enough to be considered a sleep disorder. Not getting enough good quality sleep can increase the risk of depression, overweight, obesity, type 2 diabetes, high blood pressure, cardiometabolic syndrome, as well as memory and concentration problems, can even make you look older. Insomnia in middle age or insomnia at 40 to 60. Insomnia is a symptom. Sleep disorder. Insomnia is a common condition characterized by persistent difficulty falling asleep or staying asleep. People with insomnia also experience excessive daytime sleepiness and other cognitive impairments that are directly attributable to insomnia. People may have sleep-onset insomnia, which causes difficulty falling asleep, or sleep maintenance insomnia, which causes difficulty falling asleep. Some people with insomnia have problems with sleep initiation and sleep maintenance. According to current estimates, 10 to 30% of adults live with insomnia. People aged 60 and over are more likely to suffer from insomnia, and this can be due to a number of different factors. Older adults are at increased risk of medical and psychiatric conditions that can lead to insomnia symptoms, as well as other sleep disorders such as sleep-disordered breathing or restless legs syndrome. Biological clock. Our internal clock and sleep-wake cycles can also change as we age, and these changes affect how much and when we sleep. Additionally, some medications used to alleviate the symptoms of geriatric conditions can cause sleep disturbances. The quality of our sleep often deteriorates as we age. People tend to sleep less and wake up more frequently after initially falling asleep. Sleep latency, the time it takes to fall asleep, may also increase. Some studies show that, starting in middle age, the average person loses 27 minutes of sleep per night for each subsequent decade. Decreases in sleep quality and duration are linked to the body's internal clock system. The body cannot process biological signals as efficiently, which can cause older people to go to bed and wake up earlier. Our sleep architecture also changes as we age. A normal sleep cycle is divided into 4 stages, including 2 stages of light, non-rapid eye movement (NREM) sleep, a period of heavy or slow wave (REM) sleep, the final stage of rapid eye movement (REM) sleep before the cycle begins again. Polymorphic studies have shown that older adults experience a lower percentage of NREM and slow wave REM sleep than their younger counterparts. This makes them more likely to wake up during the night and also affects how refreshed and alert they feel in the morning. Causes of insomnia in middle age. Poor sleep habits and sleep environment. These include irregular sleep schedules, drinking alcohol before bed, and falling asleep with the TV on. Pain are due to certain medical conditions. Health conditions such as frequent urination, pain, arthritis, asthma, diabetes, osteoporosis, nighttime heartburn and disease. Alzheimer may interfere with sleep. Menopause and postmenopause. During menopause, many women notice that hot flashes and night sweats can disrupt sleep. Even after menopause, sleep problems may continue. Medications. Older adults tend to take more medications than younger people, and the combination of medications, as well as their side effects, can contribute to insomnia. Lack of exercise. If you are too sedentary, you may never feel sleepy or feel sleepy all the time. Stress. Significant life changes such as retirement, death of a loved one, or moving house can cause stress. Lack of social engagement. Social, family, and work activities can maintain your activity level and prepare your body for a good night's sleep. Insomnia in middle age may be due to lack of exercise. C. Recognize signs of insomnia in middle-aged people. Insomnia and aging often go hand in hand. While many middle-aged adults experience sleep problems due to natural changes to their circadian rhythms and sleep-wake cycles, a diagnosis of insomnia in middle-aged adults must meet certain criteria. According to the International Classification of Sleep Disorders (ICD-10), a person with insomnia must have at least one of the following symptoms despite adequate sleep time and a relatively comfortable sleeping environment. Difficulty falling asleep. Instances of waking up earlier than desired often recur. Feeling like you don't want to go to bed at a reasonable time. Difficulty sleeping without intervention. Insomnia also includes daytime impairments. These can include excessive daytime sleepiness, feelings of tiredness and irritability, mood swings and irritability, and difficulty concentrating and paying attention. People with insomnia are at increased risk of accidents. If insomnia symptoms in middle-aged adults occur at least 3 times per week and last for at least 3 months, doctors may diagnose the patient with short-term or long-term insomnia, chronic insomnia. Identifying the root cause of insomnia in middle-aged adults is key to a successful diagnosis. Primary insomnia involves symptoms of insomnia that occur independently, while secondary insomnia occurs as a result of an underlying medical or psychiatric condition that causes insomnia. Symptoms of insomnia in middle-aged adults are the same regardless of whether the condition is considered primary or secondary. However, treating secondary insomnia often requires patients to address the underlying condition that is causing their sleep problems first. D. Treatment of insomnia at age 40 to 60. To manage chronic insomnia in middle-aged adults, the first step is often to focus on improving sleep and sleep generation. Your doctor will consult with you about how to create and maintain a bedroom environment that is conducive to healthy sleep, such as: the ideal bedroom should be dark and quiet, with a temperature lower than 24 degrees Celsius. The bed should only be used for the primary purpose of sleeping and not for other activities such as working and playing video games. Air conditioning should be used during hotter times of the year. Regular exercise and balanced meals. It is not recommended to use stimulants such as caffeine and tobacco. Other non-drug treatments that may help ease insomnia symptoms in middle-aged adults include controlling sleep-related stimuli. This technique is based on the idea that patients should only go to bed when they are tired. If they lie in bed for 20 minutes without falling asleep, they should get up and move to another room until they feel tired again. Furthermore, they should avoid napping during the day and commit to waking up at the same time every morning. Sleep restriction. Many insomniacs are instructed to keep a sleep diary to record their sleep and wake times, the time it takes them to fall asleep each night, and other important patterns. Based on the sleep diary notes, the doctor may ask the patient to limit their time in bed each night until their sleep efficiency improves. Sleep efficiency is defined as the ratio of time spent asleep to time awake in bed each night. When a person is able to sleep at least 90% of the time in bed, they can begin going to bed earlier. Cognitive behavioral therapy. Cognitive behavioral therapy for insomnia in middle-aged adults identifies their negative attitudes about sleep, thereby replacing them with a more positive and enlightened mindset. Light therapy. For middle-aged people who go to bed and wake up relatively early, exposure to bright light in the evening may help them stay awake a little longer and sleep later. Insomnia at age 40. You can exercise regularly to help improve sleep. If these non-pharmacologic interventions are not effective, your doctor may consider a sleeping pill. Choosing the right medication for insomnia in a middle-aged person requires a great deal of care and consideration. Some medications, such as benzodiazepines (BZDs) and non-benzodiazepines (Z drugs), produce a hypnotic effect and may increase the risk of falls in older adults. These medications also have a high tolerance, dependence, and withdrawal risk, so your doctor will prescribe other medications to prevent negative drug interactions. Types insomnia medicine others have lower risks, but they should still be prescribed with caution. Some drugs promote sleepiness by interacting with natural hormones in the body. These include Ramelteon, which acts as an agonist on receptor melatonin, a hormone produced in the pineal gland that causes drowsiness after sunset, and suvorexant, which blocks orexins, neurotransmitters that cause feelings of arousal and alertness. You should talk to your doctor before trying any medication or non-medication treatments for insomnia. Tips on improving sleep for middle-aged people. Boost your melatonin levels naturally. Artificial light at night can prevent your body from producing melatonin, the hormone that makes you sleepy. Use low-wattage bulbs in safe areas and turn off your TV and computer at least an hour before bedtime. Minimize reading from backlit devices at night, such as iPads. If you want to read from a tablet or other electronic device, turn on brighter light. Make sure your bedroom is quiet, dark, cool, and your bed is comfortable. We often become more sensitive to noise, light, and temperature as we age. Using a sound machine, earplugs, or a sleep mask may help. Don't keep a clock in your bedroom. Light can disrupt your sleep, and worrying about the minutes passing and constantly looking at the clock can also cause insomnia. Keep a regular bedtime routine for a good night's sleep. Sleep schedule should be consistent. You should go to bed and wake up at the same time every day, even on weekends. If your family members' snoring or loud noises keep you awake, try earplugs, a white noise machine, or separate bedrooms. Go to bed earlier. You should adjust your bedtime to be earlier than usual to match the time you want to go to sleep. Establish a soothing bedtime ritual. Taking a bath, playing music, or practicing a relaxation technique such as progressive muscle relaxation, mindfulness meditation, or deep breathing can help you wind down before bed. Limit sleep aids and sleeping pills. Many sleep aids have unwanted side effects and should not be used long-term. Sleeping pills do not address the underlying cause of insomnia and may even worsen the condition in the long run. You should go to bed early to improve insomnia in middle age. Sex and physical intimacy, such as cuddling, can help you get more restful sleep. Limit caffeine late in the day. Avoid stimulants like coffee, tea, soda, and chocolate late in the day. Avoid drinking alcohol before bed. Many people mistakenly believe that alcohol makes you sleepy, but in fact it disrupts your sleep. Can satisfy your hunger before going to bed. You can have some light food like diet cereal, yogurt, or warm milk. Cut back on sugary foods. Eating a diet high in sugar and starches like white bread, white rice, pasta, and potato chips can keep you awake at night and pull you out of the restorative stages of deep sleep. Avoid large meals or spicy foods right before bed. Large or spicy meals can lead to indigestion or discomfort. Try to eat a moderate-sized dinner at least 3 hours before bed. Minimize fluids before bed. Limit beverages within an hour and a half before bedtime to reduce the frequency of nighttime bathroom breaks. Thank you, gentlemen and ladies, for taking the time to watch today's video. Maintaining health in older age is an important journey that requires special care and attention. I hope the information and advice I shared will provide you with useful knowledge to maintain your health, live joyfully, and enjoy the golden years of your life. Once again, I sincerely thank you for your attention. Wishing you all good health and happiness. Please subscribe to the channel to motivate me to create more informative videos on health care. See you in the next videos.